So hey there, beautiful people. We are talking supplements today, and I know that this is tricky and confusing, and a lot of people have questions about it. So what I'm going to do today is try to clear up some of the confusion. We're going to talk about basic supplementation that probably everybody should be doing, why supplements may be important, how to be careful, very careful about supplements, as well as some supplements for some specific conditions and physiologies, and it's coming right up. So hey there, this is Lindy Ford, registered dietitian, clinical and licensed nutritionist and nutrition detective. So please, if you like this video, please just push that little like button. And also, we would love to have you in our YouTube family. So please subscribe to this channel. It's growing and growing and growing, and I'm excited about that. So supplements. We are talking supplements today. It is so confusing. What a confusing industry, because first of all, it is not an FDA regulated industry. It's really, really tricky, guys, to find good supplements. So my first rule of thumb is that you must get your supplements from a reputable company. Now, how in the world do you find that? Well, first of all, I'm gonna name about 6 of them that I like today. I don't sell supplements. You can get them from my Wellevate site at 20% off discount, which I think is an amazing, amazing, amazing deal. That's going to be linked below. But I know that there are certain supplements that are better than others, and the reason for that, first of all, let me just say, a lot of people tout pharmaceutical grade supplements. That's a good thing, but I'm not sure that that's 100% necessary if you get a reputable company. So pharmaceutical grade just means that they're trying to make the supplement like the pharmaceutical industry, that it is very calibrated, that there are no impurities in it. All good. There are no binders, but that doesn't guarantee a good product just because of that. It's a good thing, but it doesn't guarantee a good product because, again, you want a whole food supplement. So there is something that came out, I think it's in 2008 by the FDA, that these supplements get tested by a third party for purity, and that's called the GMP, which is Good Manufacturing Practices. That's another good stamp of approval, because about 1.5 years ago or 2 years ago, they did a big expose on Target supplements, and they found that most of them only had 10 or 20% of what they said they had in them. So having good manufacturing practices is a wonderful thing, but it also doesn't make it a whole food supplement, okay? So I like to go towards those companies that use more food-bases for their supplements. And one of the ways that you can check on that is when you're looking at a supplement, look to see, especially if it's got B vitamins, only if it's got B vitamins, right? If it's a multi or a B complex, make sure that it has methylated folic acid and methylated B cobalamin, which is B12. So that's one little litmus test that you can use. Number 2, remember, I said this last time, I'm going to link that link below on how to choose good supplements. Please, please watch that video. It's going to give you a lot of insight into this. So you want to make sure that you don't think that supplements are going to take the place of your food. Like, you can eat a crappy, terrible, processed diet and just wash all your supplements down with Coca-Cola and everything's going to be hunky-dory, peachy-keen. Not true, okay? Because the foundation of all of this, you have to start with good food, because again, there's intrinsic factors, there's synergistic factors that are in food, that, you know, supplements are powerful, but food is important, and probably the most important piece of this. And good food helps supplements to work better, and vice versa. But also, supplements can be a powerful and crucial adjunct to food. Sometimes you need a therapeutic amount of something. I'm going to give you one example of many. I'm going to link my quercetin video below. Quercetin is an amazing antioxidant, and you can watch that video. But just like in quercetin, like sometimes I'll use it for my allergy sufferers. suffers. I think it's amazing. It's an amazing supplement for an anti-inflammatory as well as anti-allergy, you know, for people that are on Zyrtec and all those different allergy medications. And what it just doesn't, it's really powerful, but only in therapeutic doses. One medium apple only has 10 milligrams of quercetin in it, and that's a great thing, but my dosage is usually for allergy sufferers 500 to 1,000 milligrams. That means that you're going to have to eat 50 to 100 apples a day. So you're going to have to start about 4 a.m. and just eat apples all day long to get that amount of quercetin. But the other thing that you need to know are that supplements can be dangerous. Okay, yes, they could make expensive urine, but more than that, they can be actually dangerous. I'll give you one example of many. Well, an example too would be the fact that if you're taking them with prescription drugs, there's some of them have blood thinning properties. You're taking a blood thinner already, and there could be problems with excessive bleeding. So that's something you need to be careful about. But the other thing too is if you don't know what you're doing with supplements, I've seen people take mega amounts of zinc for immunity, for their skin, la la la. And the problem with that is that people don't realize that zinc cancels out. They compete. Zinc and copper compete with one another. So they kind of, you know, if they're not in the right ratios, if you're taking too much zinc, you're going to really wipe out all of your copper, and that can lead to depression and a lot of other really bad things. That when you're dealing with supplements, you need to talk to a healthcare provider that really understands supplements. Somebody that, I'm not even necessarily saying your physician, because some of them don't understand it, but somebody who understands supplements. And this is not an advertisement for me, but I do work with people all over the country through video conferencing as well as Skype. So I just, you know, just be careful with what you're doing, because if you don't understand what they're doing in your body and you don't understand what you really need, you need to get that basic premise down. Okay, so the multis that I use, now I've worked with lots of different multis. Again, they have the methylated folic acid, methylated B12, but I really like to have a targeted multi according to gender and age. That's my favorite multi, because women's needs are different than men's needs, and age has a great deal to do with it as well. So if you're like over 40, there's over 40 multis, and if you're a male, there's over 40 males, over 55 male, whatever. And they have like the male multis normally have more prostate ingredients, prostate supporting things, and the females normally have more of the hormone boosting nutrients in them. So that's going to be a really good thing for you instead of just taking this generic multi. Here's a big thing. Whenever somebody comes into my office and they are on a drugstore Centrum, One A Day, one of those drugstore brands, I just tell them, please don't even give that away. Those are synthetic. They're the cheapest of the cheap. They have fillers. They're not methylated. They're not from whole food sources. I mean, should I go on and on? Okay, yes, they're bad. But the two that I love are the Pure Encapsulation. This is the women's over 40 formula. And I love this. I love this formula. You can get this on Wellevate. You can get this anywhere. You know, check your prices. I don't know, Amazon, whatever. But I've been using this one for years and years. Always take your multi with food. It's going to make the multi more absorbable. And then the other one that I use, I use the women's and the men's formula. This comes in over 40, and it comes in over 55. And so, and a regular women's and a regular men's. So this one has the methylation. It doesn't quite have as many of the hormone boosting ingredients. It's more of a basic one compared to this, the Pure Encapsulations, but it's an innate. This is innate. I like innate a lot. I use their GI formula all the time. It's called GI Response. I'm telling you, that GI formula rocks the world. So that's a great, great multi. The second thing that, it's almost like these are like across the board. Across the board, I probably have just about everybody on these, but of course you're gonna have to talk to somebody to know the exact dosage, and that's omega-3 fatty acids. Many of you, I've talked about this. I'm going to link a link on omega-3s. Why are they so important? I mean, I don't have enough time in this video to tell you the importance of mood. I mean, there are amazing mood boosters. your heart, you know, the heart health, circulation, skin health. I mean, it just goes on and on with omega-3s. And I'm telling you, we don't get enough in this country because we're not eating fish every single day. Most of us aren't. And therefore, we need more. I mean, I supplement with about 3,000 milligrams of it a day. And the dosage, the one that I use, I'm going to show you real quickly, is the Pro Omega 2000 by Nordic Naturals. Now, the reason I use this formulation instead of the other Nordic Naturals formulations is just because you get more bang for your buck. Per capsule, this has about 1,000 milligrams of omega-3s, which most of them only have about 500. So the price is not twice as expensive, so it's about 25% more. So you get a little bit more bang for your buck. The other thing is all of the Nordic Naturals are triglyceride based, which means that they are better for absorption, and they also are molecularly distilled, which is so important, guys. Don't ever just go willy-nilly buying your omega-3s from Costco or whatever. Be really, really careful on omega-3s. They have to be, that one I will die on the omega-3 hill. It has to be a good company. There's about 5 different brands. I have an article on my website that actually mentions that. It's called the Amazing Magic Oil if you want to look that one up. And the dosage is, I use anywhere from 1,000 to 5,000 if it's advanced heart disease and they're not on blood thinners. I normally will use 5,000 milligrams for that individual, just depending, depression or whatever, depending on that condition. But again, you know, check with someone on that. Vitamin D, I'm going to link a link below on vitamin D. How important is vitamin D? Okay, it's all about bone health. It's all about cancer prevention, especially prostate and breast cancer. Amazing research on those 2 cancers and other types. Mood, let's see, immunity. I mean, it just goes on and on. It goes on and on. And people who are out in the sun all the time are not always making enough, and there's a reason for that. You can look at that link below. It is a pro-hormone. It is involved in thousands and thousands of biochemical reactions in your body. And listen, guys, your blood levels, according to the #1 vitamin D researcher, they need to be over 60. I keep mine at around 80, and that's where I feel comfortable. You know, it's hard to OD on vitamin D. Vitamin D is one of the ones that I would say you can buy pretty much anywhere and get the same quality. That's one of the ones that you can buy in the grocery store or in the drugstore. Now, listen, the dosage is all dependent on where you're at. Again, a lot of labs will say, oh, you are okay at 30, but you're not okay at 29. That's ridiculous. You should be up over 60 milligrams per deciliter in your blood for you really to be at optimal vitamin D levels. And that's with every big vitamin D researcher out there, and I just wouldn't look at those lab levels. So take that vitamin D with omega-3s because they help to synergize each other. Then we have magnesium, and the magnesium that I use, and the one that I use mostly in my practice, is magnesium glycinate. Now, I use different brands of this, different ones that are on Wellevate, but the Claire Labs is the one I'm using right now. Lord have mercy, this thing is so inexpensive. For 100 caps, it's like $13 or $14. It's really, maybe even cheaper than that. It's really inexpensive. Most of us are deficient in magnesium because we're just not eating enough of those green vegetables, especially the leafy greens. We need to eat more of them. Heart health, nervous system, sleep, migraine prevention, bone health. It goes on and on. And the #1 magnesium researcher is Dr. Carolyn Dean, MD. I believe that that the same thing goes for the vitamin D question. You know, she's like, no. The lab values are too, when you get your magnesium RBCs done, lab values are way too low. You need to be up over 5. So look for that on your levels. The dosage on magnesium, I also use magnesium taurate for certain conditions, but I do use glycinate more often. And the dosage on that is anywhere from 100 to 400. Now, if you get to some loose stools, you need to back off from the magnesium, but that's only, you know, you only want to take magnesium at bedtime. So the other one, and I didn't bring it in here, and I should have, is the Floramax 150. Love this probiotic. I think everyone should be on some type of probiotic. Now, maybe not one this powerful. I normally only put my people who have GI issues, anywhere from IBS to Crohn's, on a Floramax 150, but I actually take it every day almost. I think it's that important to take a probiotic, but I'm gonna link my probiotic video below, but I'm also gonna link my prebiotic video, because if there's no prebiotics, probiotics have a really hard time taking hold and proliferating, and we need them for weight control, immunity, we need them for mood, we need them for so many things. And I mean, a healthy gut is a healthy body. So probiotics are one piece of that. And I really believe that that should probably be in most people's repertoire. Now, if you don't have GI issues, you could do a 50 billion with 12 strains. Like the Floramax 150, the reason I chose that one over all of the other probiotics on the market, and I think I have looked at all of them, I used to use another type of probiotic, is the fact that it has 40 different strains. And when I was really studying gut health, what the gut health researchers were saying is that a diverse gut is a healthy gut. So more diversity, the better. So that Floramax 150, I've never seen the 40 strains before, but the other ones only have 12 strains, and you could use those as a maintenance. Again, all these things are on Elevate. It's called Floramax 150. Once you get it, you do want to, and open it, you do want to refrigerate that. It needs to be refrigerated. Okay, now there are special supplements, and this would be for specialized conditions that you may have, that I use all the time, but you need to work with someone on these, okay? So B complex. B complex is so important for energy, nervous system, mood. It goes on, and I think that that is a great adjunct to many people's repertoire, but you know, it depends on if you need them or not. So my big thing with B complex, do I have a B complex here? I use the Integrative Therapeutics. Again, this is called Active B. This has the methylated B vitamins. That's a more expensive process. It is a lot of us, the researchers are saying anywhere from 50 to 70% of us don't methylate well. So it's really that methylation, or the methylated B vitamin, is the active natural form. The other one that I use is CoQ10. And I like, there's different ones that I use, like the Now brand, but CoQ10 is so important. I almost put CoQ10 on my basic list, but these are the add-on ones, and I think anybody over 40 should be on CoQ10, whether you are on medications or not. CoQ10 is a rock star. It is a rock star that so many people don't know about. I'm going to do a video. I haven't done a video yet on CoQ10, but it decreases as we age. I mean, I'm telling you guys, it decreases over the age of 35. It starts to decrease and decrease and decrease. And we need it. We need it so much for heart health. We need it for energy production on the cellular level. It helps to create energy within the mitochondria of the cell. I mean, how huge is that? And so there's so many amazing things about CoQ10. It's good for skin. It's good for so many things. Now, here's the deal, guys. If you are on a heart disease medication, really any of them, but especially a statin, your level of CoQ10 needs to go up. So the people that are on statins, I put them on like 400 milligrams of CoQ10. And the higher your age, you need to be on more CoQ10. So again, work with somebody on that, but it is really important nutrient. And I like it, it's a little bit confusing. There's CoQ10 comes in ubiquinol and ubiquinous. I actually like the all form, but that jury's out on that. We really don't know which one works better. We think that all form works better, so I always buy it I always have my patients buy it in the all form, ubiquinol. So then there's the other honorable mentions are chromium for blood sugar. I'm going to link alpha lipoic acid for so many, anti-aging and blood sugar control and anti-cancer. Oh my goodness, ALA is amazing. Again, there's a caveat to that. You need to watch that video on ALA. Berberon is another one. Amazing. I can't live without berberon and ALA. They're the two because such a blood sugar person, such an insulin metabolism, such a diabetic ready to happen, I need those 2 supplements. And then I also put a lot of people on Vitex because it is naturally increases progesterone for women, especially that are in estrogen dominance. Doesn't mean you're making enough estrogen, means you're not making enough progesterone, as well as anybody who has PMS and menopausal symptoms. I use Vitex a lot. Bone formulas, I have a bone formula that I use for, especially for women. I actually used it on a male the other day as well because of osteoporosis, osteopenia. I also have I have a protocol for GI issues that I use that GI response. I use the innate one as well as a probiotic, as well as some other things for GI issues. There's I use a blood sugar control by integrative therapy. So you see that these are special conditions. There's the basic 5 that I told you about, and then there's all these special conditions. So you want to so that your supplement program is tailored to you and your physiology, not to your sisters, not to your mom, your dad's, your spouse, but to you. You need a very tailored supplement system that's not complicated, and so you just need something that is going to work for you and that is going to help you to achieve optimal health. So thank you so much for viewing today. Let me know if you take any of these different supplements and what you think of this video. Again, supplements are tricky, and please be careful with them, and but also remember how powerful they are, and they can really make a difference in your overall health. So please subscribe to this channel. Also I'm kind of new on Instagram. Please look me up on Instagram, Lindy Ford Wellness, as well on Facebook and Twitter. I'm there as well, and I'd love to hear from you. Just say, hey, I saw you on YouTube. And listen, I want everybody out there, every single person, to know that they deserve the freedom to live their best life. I will see you in the next video.